Taylor, what's up?
Hey, I lay down for a nap and I completely overslept. I also completely forgot we have a med micro exam tomorrow. Could you please meet me somewhere to study?
Yeah, I'll meet you there in a minute. Everyone knows you can't study without a diet Dr. Pepper.
Oh my gosh, thank you so much for coming.
You're welcome.
Karielle, where should I even start studying for this?
Okay, first of all, be careful with that book. It's written by the Rodney Anderson. And second of all, you want to start with typhoid fever. That's what the extended response is going to be on, and that's where most of the points are.
Okay, so I know that the name of the disease is typhoid fever, but what is the pathogen name?
I actually put it up on the board for you to look at.
Salmonella enterica serovar typhi.
Not exactly. Salmonella enterica serovar typhi.
Okay, so now that I know what the name of the pathogen is, what does it look like?
I pulled up a picture for you. So it has this gram-negative rod shape with O antigens 9 and 12, and then it has peritrichous flagella, which basically means it just has flagella coming out of all the sides. And then it's surrounded by a polysaccharide capsule to keep in the genetic information.
So what type of pathogen is it then?
It's actually a facultatively anaerobic pathogen. Do you know what that means?
Actually, yeah. So it makes ATP through aerobic respiration if oxygen is present, and if oxygen is not present, it will switch to anaerobic respiration or fermentation.
Yeah, that's right.
So it says here in our notes that we need to know all about the transmission. Can my dog get this?
No, the reservoir is humans only, so Sparky is all clear. It can be found in shellfish that are taken from beds of water that are contaminated with fecal materials, water that's contaminated with sewage, foods, milk, water that have been contaminated, things like that.
So then what is the mode of transmission?
So it can be transmitted from person to person or through the oral fecal route.
Ew.
Okay, so here you can see the little Billy who's clearly sad. He has eaten a carrot that was contaminated and fertilized by fecal material. There's two options for this pathogen. It can either enter his system and be in there for a couple months to a couple years, or in 3% of the population, it'll be in his gallbladder forever.
Oh my gosh, that would literally stink.
I think all that studying calls for a short study break.
I think so too. Cheers to typhoid fever.
And never getting it.
Hey, what are you guys doing? Are you guys studying for the med micro exam?
Yeah, actually, do you know anything about typhoid fever?
Yeah, I had typhoid fever a couple of years ago.
Oh gosh, tell us more. Here, pull up a chair.
Actually, you can have mine. Me and Taylor just went over transmission and etiology, but I have to go for a little bit.
Okay.
Maybe you could tell me more?
Definitely.
So you had typhoid fever? That must have been awful.
Yeah, I remember having symptoms like diarrhea, flu-like symptoms, headaches, muscle pains, weaknesses. I was coughing at some point.
So I read in my notes that one of the symptoms is like a rash. Did you have that at all?
Yeah, actually, that was one of the most visible symptoms I had. It was on my stomach and it was all rose-colored. That's the reason why I had to go to the doctor.
I remember seeing all of that in the clinical features section of our book. So how did you get treated for that then?
Well, mine was a little on the less severe side, so my doctor prescribed me ampicillin. So it went away within about 2 weeks, but that's on the lesser side. Some people have to go through treatment for about 4 weeks.
Wow. So is there anything that the average person can do to prevent getting typhoid fever?
Yeah, so my doctor actually told me that whatever you get, you should either boil it, peel it, cook it, or forget it. So you should just pretty much assume that everything you're gonna eat is unsafe.
So basically just avoid any food or drinks that you think could possibly be contaminated?
Yep.
I'm also assuming that there's a vaccine for this since there's a vaccine for everything nowadays.
Yeah, actually there's 2 vaccines. So there's a VICPS vaccine and there's the TY21A vaccine.
Okay, thank you.
I'm really tired. I've had a long day, so I have to go, but text me if you need anything else.
Thank you so much for your help.
No problem. Good luck tomorrow.
Thank you, I'm gonna need it. All right, Taylor, now let's learn some pathogenesis. First step, entry. The route of entry is ingestion of bacteria from shellfish grown in water contaminated with human feces or milk, water, or other food. Attachment. The pathogen attaches to the surface of the mucosa of the small intestine. Step 3. Avoiding host defenses. The Vi antigen, a protein on the surface of Salmonella, blocks binding of certain classes of antibodies. Salmonella, Enterica, Cerevar typhi, is also highly resistant to bile. The pathogen is not destroyed, but multiplies in the protected intracellular environment. 4. Damage. On secondary entry into the intestine after replicating in the lymphoid tissue, the large number of bacteria causes necrosis of the Peyer's patches, which may lead to abscess formation. And the final step, exit. The pathogen is excreted in the feces.
Hey Taylor, how is the studying going?
Oh, it's coming. I'm actually on the diagnosis right now. So I've learned that there's basically 2 ways to figure out if someone has typhoid fever. The first way is through a blood sample, and the second way is through a stool culture.
Yeah.
So it says here that they test for growth of black-centered colonies on Salmonella Shigella auger, or agglutination testing for the identity of O and H antigens.
Yeah, that's kind of what I showed you before when we looked at the picture. You really know your stuff. I feel like you're prepared for tomorrow. I'm gonna go to sleep. Do you need anything else?
Actually, I don't think so. I feel like I'm pretty prepared.
Okay, awesome. I'll see you tomorrow in class.
Thank you for all your help, Karielle.
You're welcome.
I got a 100%. I guess cracking my hand on the table and guessing worked after all. I'm just kidding.
And they say yeah, and they say that.